The primary goal of complementary alternative medicine is to assist the doctors in their plan of caring for the patient. Ruth McCarty, a licensed acupuncturist at Children's Hospital of Orange County, explains how this kind of alternative medicine can complement treatments currently being given to patients.
I am a traditional Chinese medicine practitioner. I practice traditional Chinese medicine at Children's Hospital of Orange County. It is an alternative medicine in the sense that it is not a mainstream practice in the Western setting. It is complementary because the way we have set up this program is I am added to the best Western care that the patient can get, and it's not competing, it is just a service that is added on top of their Western care, being complementary to the care they're already receiving. I am consulted by physicians. It's a physician-driven consult. So I will round with physicians on all the floors in the pediatric intensive care unit, the med-surg floors, the neonatal intensive care unit, and the oncology floor. During these rounds, we identify a patient who can benefit from my services. A common patient that I treat are brain tumor patients, post-surgical brain tumor patients. These can be not only a brain tumor patient, it can be a malignant brain tumor, which the treatments they will receive are radiation and chemotherapy besides the resection of a tumor. So the goal of bringing me in with these patients is to lessen the side effects from all the invasive procedures they have. Post-surgical pain, nausea and vomiting, insomnia, anxiety. These are all symptoms that are well treated by my services. The modalities that I practice inpatient at CHOC are acupuncture, acupressure, Tui Na, which is a type of medical massage, and also Reiki therapy. Reiki isn't under the realm of Chinese medicine per se. It's an energetic medicine. It's more of a balancing of energy. It's like a type of massage. And it started with one physician being interested in it. And he started Dr. Loudon, who is a pediatric neurosurgeon at CHOC. He started referring me patients when I was an intern to the outpatient clinic because he found that it added a lot to his patient care and the deficits of what he could offer the patient.
I noticed more and more over the course of my experience that my patients didn't do as well as I thought they should be doing, that there were gaps in their healthcare, gaps in their overall well-being, and I looked for ways to fill that. I didn't find a great wealth of opportunity in traditional Western medicine to fill those gaps. So I looked elsewhere, and sure enough, I found what seemed to be an ideal solution. That is the philosophy of traditional Chinese medicine. When I fostered that here, I wanted to see that the two were absolutely tied together, that in fact, the physician had to request and had to supervise the role of the traditional Chinese medicine delivery to their patients. And together, the system works fantastic.
He was kind of the first physician to recognize the benefits of it. And then together, we started approaching CHOC with the idea of adding it as inpatient services. And through education, we really came up against very little we came up against no opposition to it with educating the hospital of what it entailed. So he was the first physician who really saw the need. Now I get referrals and consults from basically all the different departments of the hospital.